Welcome to Medicare for All Explained. This podcast will enlighten our listeners and dispel the distortions that surround Medicare for All. Medicare for All Explained is produced in collaboration with Physicians for a National Health Program and is hosted and produced by Joe Sparks. I'm your host, Joe Sparks. This is episode 112, The Harm Caused by Medicare Advantage. In my previous episode, We Don't Need Medicare Advantage, I discussed why Medicare Advantage is unnecessary. In this episode, I discuss some of the harmful effects caused by Medicare Advantage. Physicians for a National Health Program, or PNHP, released in May of this year the report, Taking Advantage, How Corporate Health Insurers Harm America's Seniors. It states the damaging effects caused by the way health insurance companies run their Medicare Advantage plans. I have provided a link to the report in the description for this episode. Here are some of the problems with Medicare Advantage according to PNHP's report. There are anywhere from 11 million to 20.5 million hours per year wasted by medical practices on Medicare Advantage prior authorization requests. 7.3 million Medicare Advantage beneficiaries are underinsured due to high healthcare costs. 11.7 million Medicare Advantage beneficiaries are in a narrow network plan that excludes more than 70% of physicians in their county. 36 studies cited in PNHP's report collectively found negative outcomes for patients and providers in Medicare Advantage. One example of a severe negative outcome is that Medicare Advantage beneficiaries had double the increased likelihood of death after pancreatic surgery in cancer patients. As the PNHP report states, narrow networks compromise access to the best quality of care for the sickest individuals. The report continues, cancer care, already a nightmare to navigate for anyone regardless of their insurance, is especially bad for Medicare Advantage patients in terms of network inclusion. It explains that the narrow networks often prevent Medicare Advantage patients from getting cancer care at teaching hospitals or hospitals that specialize in cancer care that get better results from the complex surgeries that are required. The report further explains that compared to traditional Medicare, quote, this lack of access, largely a result of narrow networks as well as delays in receiving care, was found to have likely contributed to higher 30-day mortality rates for liver, pancreas, and stomach cancer surgeries. In other words, narrow networks are killing cancer patients. End quote. Let me say that last sentence again. In other words, narrow networks are killing cancer patients. And let me add that this is done so the private Medicare Advantage insurance companies can increase their profits. The contrast between Medicare Advantage and traditional Medicare provides clear and strong evidence that a single-payer healthcare system provides better results than a system based on for-profit insurance companies. And, as I've illustrated in my previous episode, Medicare Advantage costs more for worse results when compared to traditional Medicare. While the report focuses on Medicare Advantage, the problems caused by narrow networks, prior authorizations, and care denials pervade the private for-profit health insurance companies. The difference between Medicare Advantage and traditional Medicare makes it obvious that if we want to deliver better medical care in the United States at lower costs, then we need to implement a single-payer Medicare for all healthcare system. Thank you for listening. You have been listening to Medicare for All Explained. Remember to tell your family, friends, and colleagues about this podcast. Information about Medicare for All Explained can be found at our website, medicareforallexplained.org. The music for this show is Super Bubbly by Jesse Spillane. The logo was created by Lily Sparks. Thank you for listening.